Friends, very few topics evoke so much of anxiety, so much of displeasure, so much of despair and disgust as the failed erotic possibilities of our bodies. When we look at women and we identify them as individuals who are unable to get consummated only because of issues which are plaguing them, one of them is a difficult topic called vaginismus. Vaginismus, or significant massive contraction of the vagina, which happens as a result of the muscle contractions. A lot related to fear, a lot related to body habitus, a lot related to the incapability of being able to relax, to a male phenomena, to a dilatation, to an examination, is called vaginismus. And women do suffer from this entity at various age groups, more so in younger formative years of growth, and having identified the body as one where they're quite anxious about this phenomenon. Refractory vaginismus is still a bigger phenomenon. Sadly, women suffer, and this is completely in silence, an agony that is probably missed out in the purview of even a gynecologist, in the purview of many therapists, and obviously mothers and the fraternity. So when we look at women with refractory vaginismus, where the vagina contracts to a reception activity instead of relaxing, something where a woman goes through a trauma of not being able to be consummated, is a difficult phenomena in those days in early partnership. And therefore, many marriages fail, many marriages become difficult. And this is a phenomena which has been missed out in the history of mankind because it has all been hidden under the carpet, not much discussion in the gynecological forums around and in various fertility forums around. But when we look at evaluation for infertility, when we look at evaluation for non-consummation of marriage, when we look at couples otherwise, we look at these couples probably growing in great bondage, but the physical bondage is close to zero because she has never been penetrated. She cannot be. Lamont's classification of vaginismus takes it from 0 to something as high as grade 5. That means a progressive, difficult phenomena which continues to bring about so much of despair and don't know where to go to, has its own answers. At the Kokilaben Hospital in the Department of Urology, since I did participate in this major trial in 2005, 6, 7, we did work upwards and looked at women who had refractory vaginismus. And now, at this hospital in the last 16 years, women who had refractory vaginismus from all over the globe, obviously Mumbai, Delhi, Calcutta, Madras, and cities from various parts of the world, who had refractory vaginismus have seen their psychiatrists and clinical psychologists, who have looked at their own partners, who have looked at gynecologists and have undergone treatments and have failed and labeled as refractory vaginismus, have actually responded to this therapy called botulinum toxin therapy or Botox therapy intravaginally, which means we are looking at a chemodenervation temporarily of the vagina, where this excessive innervation, excessive phenomena, excessive sensitivity and spasm is not letting her consummate. A very, very difficult phenomenon to talk about. We normally don't talk about all these things around and we miss out. And when we talk about erectile dysfunction, male phenomena, failing men, but they're also failing women. And they're not failing because of any mistake of theirs. It's just a phenomenon. It's a phenomena which from somatic or body phenomena becomes a psychosomatic phenomenon. She's afraid. She's afraid of a clinical examination by a gynecologist, a close gynecology friend, by the own partner, by herself in a privacy of hers. And the refractory vaginismus only becomes a vicious cycle. Over the last 150 patients, I would say, who are well-to-do women, who are women capable in the society, who were actually doctors, lawyers, practitioners, nurses, and everybody in the society at different walks in life, actually did suffer with refractory vaginismus for a period, anything lasting between 1 year to 10 years. There were doctors who were injected by me in a very planned fixed dosages of the botulinum toxin in the lateral aspect and the posterior aspect of the vagina, so as to bring about a temporary chemodenervation of these excessively contracting vaginal muscles. Vaginal muscles are very capable, strong enough to even expel a baby when in the third stage of labor. So why not look at these women? The awareness on this subject is missing completely. And in the gynecological forums and infertility forums where I demonstrate and speak the technique that we do around, we look at the Lamont's classification, we look at the PASIX study. I was a part of the trial, and we look at the right individual getting the right dosages. And thereafter, a lot of confidence building measure for her and for her partner. Looking at calibrated self-calibrations, supervised calibrations and dilatations, hand-holding the journey towards consummation is a very, very important phenomenon. And I know that this is missed out. This is not a subject talked about. It's not one of the technologies which is driving it. But having looked at this, having even enrolled in the US FDA trials in that era, having looked at individuals getting a life completely where the bondage becomes right, capable, and physical, I think it's time to wake up to this phenomena where a disgusting erotic possibility which is failing completely can be sorted out. For all women who suffer from refractory vaginismus, who actually have undergone episiotomy, who undergone dilatations, undergone psychiatric therapies and clinical psychological workups, probably it's time to evaluate, examine, and get them sorted out. For the last 16 years at the Kokilabin Hospital, in the Department of Urology, having carried this important benchmark from my days back in Ramachandra Medical College Hospital in Chennai, feels good to probably treat and wholesome, give them a cure, give them a life of confidence, which actually has been missing. So women with refractory vaginismus, having attempted therapies and can't be consummated, let them not be divorced, let them not go through a agony and pain beyond what they're already going through. It's so much in the mind, so much in the body. They think it 100 times a day as to when will I come out of this. And therefore, there is answer. A very planned way of doing it, a very confidence building way of approaching it towards short general anesthesia, injecting Botox into the right muscles into the right way, and then looking at the calibration, self calibrations after supervised calibration dilatations, and then taking this partnership to the next level will be the order of the day. There's not much therapy available in this subject, and the subject has been missed out completely. So, friends, refractory vaginismus has a cure. It has a cure in botulinum toxin to the level which it was never. And probably we've not talked loud and clear on this forum, not even in your channel, which I should have done long back. And it's time to wake up and probably pass it to all women and to all gynecologists. I remember a few gynecologists, having looked at the workshops that we created here, did came, learned this technique, and probably went back and probably became masters of the art. So, time for all women to wake up to refractory vaginismus. Cure is around the corner. Let's not suffer and let's continue to probably get better and better on this health, which is quite missed out, quite hidden under the carpet. Treatable, incurable, refractory vaginismus. Thank you so much.